Thank you all for being here today. I'm here with Commissioner of Health, Dr. Lance Frye, Secretary of Education, Ryan Walters, and Representative Rhonda Baker, a former teacher and chair of the House Common Education Committee. Thank you all for being here today. Throughout this pandemic, we focused on three things: to protect the health and lives of Oklahomans, to keep our businesses open safely, and to keep our kids in school safely. I've heard from so many parents, students, and teachers about how hard this year has been. Students are struggling academically and also emotionally from being away from their classmates. As a father of 6 kids, I'm a school parent too. Many kids have had the option to be in-person school in the state of Oklahoma, and I believe that all children deserve that same opportunity. We've heard from teachers, parents, and students across the state who want to be safely in person in school. This needs to happen as soon as possible. It's a non-negotiable to me. Here's what the director of the CDC has said about schools. I'm quoting, "There's extensive data to confirm K through 12 schools can operate with face-to-face learning, and they can do it safely, and they can do it responsibly." He also said the infections identified in schools were not acquired in schools. They were actually acquired in the community and in the household, but it's not inter-school transmission.
The truth is, for kids K through 12, one of the safest places they can be, from our perspective, is to remain in school. And it's really important that following the data, making sure we don't make emotional decisions about what to close and what not to close. And I'm here to say clearly the data strongly supports that K through 12 schools, as well as institutes of higher learning, really are not where we're having our challenges. And it would be counterproductive from my point of view, from a public health point of view, just in containing the epidemic, if there was an emotional response to say, let's close the schools.
I am committed to making sure that each Oklahoma child can get the education that they deserve. You know, we sent PPE to every single school in the state. We provided grants for schools to help cover COVID expenses. We've worked with the health department and the CDC to reduce quarantine times down to 7 days with a negative test. We've limited attendance at school activities to 4 spectators per person, per participant, no more than 50% capacity. This lets students keep doing the things they love while keeping everyone safe. And now today, I'm pleased to announce that I've directed the State Department of Health to move K through 12 teachers and support staff who interact with students up to phase 2 of our vaccine distribution plan. Our teachers are so important to me. We know this more than ever before, especially the moms and dads who have tried to help teach their kids through distance learning. We're going to get through this, and we're going to get our kids back to school safely. Now I want to turn it over to Dr. Frye for some updates.
Thank you, Governor Stitt. Throughout Oklahoma's pandemic response, the health and safety of our teachers and students has been one of our top priorities. The Oklahoma State Department of Health has been working diligently to establish guidelines and provide resources to keep students in school and our teachers and staff safe. Moving K through 12 teachers to phase 2 for vaccine priority will help ensure we get all of our teachers and students back in school safely and as soon as possible in the new year. We continue to innovatively work with school districts to balance the health, safety, and well-being of our students, teachers, and staff to ensure academic success for all. Our teachers are on the front lines of this pandemic, and moving them up in priority is another tool we can give them to help get everyone back in school and keep them safe. While our timeline remains dependent on our vaccine shipments, we're hopeful we can move quickly through phase 1 and into phase 2 early in the new year. I can't reiterate enough, while we're excited about what the vaccine means for our future, it remains critical that everyone continues to wear a mask, watch their distance, and wash their hands, and be patient as they wait for the vaccine. These continued mitigation strategies are actions our communities can take to help our schools open and reduce the burden on our healthcare system. I'll now turn it over to Secretary of Education, Ryan Walters.
As a teacher, there is nothing I love more than being in the classroom with my students. Watching students learn firsthand, developing that relationship with all of my students, it brings me a kind of joy that's really unique. I know thousands of teachers across the state feel the same way, and they want to have students safely return to their classes so that they can have that impact on their students. Moving teachers up in priority for this vaccine shows that we know teachers are critical as we continue to fight this pandemic. We know many of our students are falling behind academically. We must do everything we can for every Oklahoma student to ensure that they have the best education possible while minimizing the risks as best as we can. I believe moving teachers up for the vaccine shows we value their work and we value their contribution to the state of Oklahoma. I can't wait to get back in the classroom and see all of my students, and I know that teachers around the state can't wait for that opportunity also. I will now turn this over to House Education Chairman Rhonda Baker, a former teacher also.
Thank you, Mr. Secretary. Thank you all. I am Representative Rhonda Baker, as he said, a former teacher. I am also chairman of the House Common Ed Committee. I am here on behalf of the House and my colleague, Senator Adam Pugh, who has just been named chairman of the Common Ed Committee in the Senate, to be here with Governor Stitt, to acknowledge Secretary Walters, Dr. Frye, and others who have worked so hard on this policy. As a former teacher, I know how desperately teachers and students want to be back in school and be there safely. I am very proud of Governor Stitt for his leadership in the fact that he's fighting for our kids and for our teachers to be back in school for some normalcy. I was with the governor and Secretary Walters earlier this year when we had a group of teachers that came and spoke to us, and parents were included in that also, discussing the struggles that they've had with education and distance learning. We've heard stories about students who aren't just falling behind academically, but they're having emotional issues from not being in school. They're going hungry without the consistency of school meals. And there's countless child abuse and neglect cases that are being missed because those children are not in the classroom so that their teachers can report those issues. We know without consistent school, it is hard for students to learn and for parents to work. It's so important that we do everything we can to get students and teachers back in school and do it safely. So, giving our teachers the COVID-19 vaccine as soon as possible will allow us to safely get our kids back to school and the teachers to be back where they desperately want to be. Governor Stitt, Commissioner Frye, Secretary Walters, thank you all for your leadership and for continuing to fight for our teachers and our students. Thank you.
Thank you so much, Representative Baker. I'm so grateful to have strong partners like you and Senator Pugh from the Senate. Teachers, thank you again for everything you're doing. I know this year has been super challenging, like no other school year ever. I've listened to your stories about how hard it is to prepare an A-B lesson plan, also teach some of them in person and also do a online version of a lesson plan. I want you to know that there is light at the end of the tunnel. I know so many of you want nothing more than to be back in the classroom teaching students. That's what you love to do. We are going to make this happen. Parents and students, I hear you. I'm fighting for you. Let me be very clear. I want every Oklahoma school child to have an in-person option in January, period. We want every kid in the state of Oklahoma to have that opportunity. If you're with me, call your local school boards. Thank them for giving you an option to choose what's best for your kid. If you don't have that option, tell them your story. Let them know how important it is for you, your kids, your community. And also, don't forget that one of the best ways that we can fight for getting our kids back in school is to do our part as a community to slow the spread. Yesterday, I was in Lawton, Oklahoma, as we did the vaccine rollout for Southwest Oklahoma. We gave the first respiratory therapists, ER nurses, ER doctors, their vaccine. They're distributing it across Southwest Oklahoma. 2 days ago, we were here in Oklahoma City at a press conference at Integris, and Hannah White, the first person in Oklahoma to receive a vaccine, the ER nurse. They've since given out 1,600 vaccinations all over Tulsa. All over Tulsa, they are distributing the vaccine now. So hope is coming. But we can't take our foot off the gas. Please follow the 3 W's. Washing your hands, watch your distance, and wear a mask. We've got to keep doing this together. Hope is around the corner. So thank you. We'll open it up to a few questions for our panelists.
Kevin Stitt, are you going to have to take anybody out of phase 2 after you add all these additional teachers into phase 2?
Let me let Dr. Frye answer that.
No, we're not going to be taking anyone out of phase 2. We're just moving them up, and they'll run concurrently with others in phase 2.
I know you did do other essential employees like grocery store workers and other people are thinking the economy money to get case workers up. Are they not as important to the economy as teachers are? And how are you prioritizing winners and losers in the vaccine priority scale?
Well, we feel very, after the CDC's recent information that they put out with all the data supporting it, we feel very comfortable with having everyone back in school, and we just want to be sure that we're doing everything we can to protect them at that time.
What's the grocery store workers who are waiting, who's been
They're-
like on the line every day?
We still have essential personnel that are in their phases, where they are, but, it impacts the education of our children, and if it can be done safely, we certainly want to accomplish that.
What's the most realistic timeline that teachers will start getting that vaccine?
Great question. That depends on the frequency of our shipments and also the uptake that's done from the phases. As we've talked about before, we're not going to wait. We're not going to wait till every single frontline healthcare worker gets a dose. If they are not wanting to take it at that time, and we're going to move on to the next person. So we're hoping the first part of the year, hopefully in January.
Do you anticipate a plan, especially with such limited supply, going district by district, or have elementary show up on one day, and middle school maybe 2 weeks later in a certain district? How do you administer such huge doses on all districts this soon?
We know that within each school, there are prioritizations within those priority groups, right? So there are teachers that are older with comorbidities, and there are teachers that their jobs might put them at higher risk than another teacher. So we're going to let each school district prioritize those teachers as they feel needed in order to get the ones with the highest risk and highest priority first.
Is there a reason pre-K is not included, or is that just?
The information that we got from the CDC was K through 12, and so that's where we're starting.
Early in the
presentation, I think it was mentioned that kids are the ones, kids that do get the virus aren't getting it exactly from schools, but they're getting it from community or at home. What has been done, or what is going to be done in order to make sure that kids don't spread it to each other within the schools? Because we've seen examples throughout the pandemic with parents sending their kids to school even though they have COVID or knowing they have symptoms. So what is the plan as far as that goes?
Well, we've worked with the schools and given mitigation efforts to them, or ways that they can help mitigate the spread throughout the schools by having assigned seating, having desk or seats spaced at the proper spacing things, and CDC has come out with guidelines for them as well, as far as guidelines to help them do this safely.
Are there any penalties for a teacher who does not want to be vaccinated and maybe they want to see things play out a little longer?
No, there are no penalties for anyone who does not want the vaccine.
Now, will substitutes, extra staff also be getting the same kind of vaccine during with the teachers?
We will be doing support staff as well.
Commissioner Frye, I've heard anecdotally that testing across the state is down, and I'm wondering if that is due to the fact that we're almost at the deadline of the CARES Act funding. And I'm wondering if is testing down, and is that due to less CARES Act funding?
We've actually still seen quite a large numbers in testing. Keith, do you have any specific information? 26,000 a day. About 26,000 a day on testing still, so it's still up there.
Can you tell us what positions are included in the support staff?
What positions are included in support staff? We're just saying all support staff, so we want the schools to be a safe place. I don't have a list, but cafeteria workers, bus drivers, et cetera, those would all be included.
Just to clarify, schools could still do online, but they have to offer an in-person option. Is that what we're talking about here?
I'm going to let Governor Stitt answer that. I know he's giving, wants every person to have the option to be in school, and we're trying to encourage that as much as possible by making it as safe as possible.
Yeah, I'll respond to that. So the governor's position is that students are offered an in-person option, that we want every student in the state to have the option to attend an in-person setting in their school. Hope that helps.
I still don't understand. Are schools going to be required to have an in-person option, or is this the governor's position would like this to happen?
Our position is we want this to happen. We want every school to offer this to students.
Legal pressure, like some parents want to stay out?
Right now, our position is we want to see all schools make the decision, again, local school boards to make that decision to offer that to their students.
Yeah, and the way our system's set up, a local school district still gets to vote and choose what their options are. And so that's what breaks my heart the most is Hennessy and Adair and Guthrie and all the schools around the state, for the most part, I think up to 93, 94% have been in person. But some of the schools have not been in person since last March. It's almost a full year. And so that's the vision I'm casting. And but ultimately, it's a local school board decision. So I'm saying let's give every kid an in-person option. And of course, if there's extenuating circumstances or there are reasons that a student needs to choose to do virtual learning, we want to give them that option as well. But my heart breaks for these kids that have not been in school since last March.
So this is an hard and fast rule that is a goal, and then also no penalty for a school district that does not feel like they're able to offer it.
Yeah, the way our system's set up is the governor cannot dictate that Tulsa Public Schools open. That is a local school board decision. I encourage our state school board, whatever they can do to put pressure on Tulsa to open up, Oklahoma City. I think both of them have plans to do that. And that's our goal, is we want to get our kids back in school.
Can you think what you mean by pressure? One of the things
Well, the pressure is I'm standing right up here right now telling Oklahomans that I stand with you. We need to get our kids back in school.
What do you think that looks like?
Well, the state board potentially could pass some kind of rule that I think could supersede some of the different school districts and some of their decisions. That's things that the legal department can look at. But we have got to get our kids back in school. It's been since March. COVID's still going to be here in January. It's still going to be here in February. We can do it safely. Kids, educating our young people is a non-negotiable. So is the health and life of Oklahomans. So is keeping our businesses open. We have to look at all those together, and we have to do it safely. And I believe we can. I mean, you see different states, New York City, for example, are wanting their kids in school. The CDC is stating that we need to get our kids in school. There are other consequences with keeping them at home, and those are things that the media is not talking about, and we need to talk about to make sure there are consequences with keeping our kids not in school.
There's suggested that basically mask ordinances be left at the local level, local control. How do you reconcile that position with your position on schools?
So we're wanting to give the schools the freedom to, obviously there's, I think probably 90% of the schools have some kind of mask mandate locally, and that's great. If that gets our kids in school, we want them to do that. But ultimately, it is a local school board decision, so the parents have got to get involved to make sure if they want their kids in school, they're going to have to help. They're going to have to join in with the pressure with whoever's voting to keep them out of school.
Well, you mentioned that the State Board of Ed could pass some sort of rule asking that schools have in-person options. Will you control the majority of the members on the State Board of Ed, or who appointed them, I should say? Will you ask those people to pass such a rule?
Absolutely. I'll do everything. I'm up here publicly saying my goal is to get every kid in school in person in January, however we need to do it. I plead with the board members at Tulsa and Oklahoma City and any other school district in the state that's not giving their kids in-person options. I believe that's what the parents want. I believe that's what the data shows. And we cannot lose another semester educating our young people.
So now, what point during your conversations with parents, teachers, students, did you feel as though, okay, we got to do this, we got to move teachers up in the distribution plan?
Well, we certainly, from the very beginning, last August, if you remember, we met with the school decision makers, State Board of Education, and they said we need PPE for our schools. So we spent $10 million. We got PPE out to every school district in the state. We've given more grants for funding for COVID-related expenses and cleaning and fogging and all the things they're doing. And there are schools all over this country and all over the state of Oklahoma that are doing it safely. Broken Arrow Public Schools, for example, they've got 15,500 students in Broken Arrow Public Schools. They've had about 3,500 in quarantine through contact tracing, and 26 have turned up positive. That's 0.7%. And so the data shows, just like the CDC said in the video that we showed, that these kids are safe in school, that this is not being transmitted into schools.
Are you working on a plan for the universities and colleges? I remember before Thanksgiving, you were asking college students to get tested so they can bring the virus home. Is there a plan for that group of education institutions?
Yeah, I mean, we obviously are limited on the number of vaccines that we have coming into the state of Oklahoma. I think it's a really positive thing that we're going to have close to 166,000, I think is our last count, of vaccines coming in by December 30th. Universities have been in person, or depending on the class size, they've done some virtual stuff. They let out at Thanksgiving time, did the finals virtually, and so it's my intent that that the colleges are handling it pretty well, and they will have in person in January as well.
Dr. Frye, can you go over, so if we're going to continue to work on phase one, will we be in phase one still while administering phase two, teachers and others?
So yes, obviously we're prioritizing different groups in different phases as was recommended from many different organizations. But in reality, a lot of these are going to be running concurrently. So you're gonna be pushing, while you're doing some of our healthcare workers next week, we'll probably be starting on our long-term care facilities as well.
And what is your goal to have, when is your goal to have these teachers vaccinated?
As soon as possible. It's very difficult to predict. We'd like to do it as soon as possible. We hope that we can get started in first of the year.
Dr. Frye, is it safe to do in-person learning if you've got a high community transmission level?
There's data out there looking at that, and they have some plans on how to help mitigate those situations. So we think we can do it, especially if we can get people vaccinated.
Does it matter where in phase two? Like, obviously there's a few steps in phase two for different groups of people getting vaccinated. And I know that you said that it'll all kind of run concurrently, but does it matter where in phase two that teachers are?
We know a lot of them are going to be in the, we're starting with the highest risk groups, obviously, long-term care facilities, 65 and older with comorbidities, but we know that teachers are going to be fitting into some of those groups. And so they're going to run concurrently with some other groups within that same phase.
Before we go, quick question, can you give us an update on what happened to the unemployment check announcement that was supposed to take place last week? Now those checks are not being distributed, is that correct? What happened there?
Yeah, that was, so the Unemployment Commission basically had some extra money, and the way I understand it, they went to the Department of Labor and they thought they could distribute that directly as one-time payments to the folks that were on unemployment at the time in the state of Oklahoma. They got clearance from them, but then FEMA came back and told them, no, they're clawing back that money. You can't use it for that purpose. So at this time, they got bad information, and they did not want to get those dollars out when there was a question mark and get it potentially clawed back. So at this point, they just let me know that they will not be doing that they got bad information the first time.
When you say claw back, the feds took their money back?
The feds said that, yes, you can't use it for that purpose. The feds were clawing back because those were federal dollars. So that $60 million was being clawed back, or basically retrieved back from FEMA, was taking it back from the state of Oklahoma.
So if you find another purpose that's authorized for that $60 million, could the state still get that money back for other purposes?
I'd need to check with them. It was designed for unemployment benefits, and for whatever reason that had ended, and they felt like through talking to the Department of Labor that they could actually distribute it this way, and then FEMA came back and said no, and it was a little bit of fight between FEMA and the Department of Labor, and ultimately FEMA was taking that money back.
But no checks?
No.
Nobody would have been allowed to look at?
That is correct. That is correct.
What phase are school children going to be vaccinated in? I thought it was like phase 3 or 4, but then I thought it was...
Let's bring up Deputy Commissioner of Health, Keith Reed, to answer that different phase.
So at this time, the Pfizer vaccine, which is the only one that has got the emergency use authorization, is not authorized for anybody under 16. So many of the children in the K through 12 category are not yet eligible for vaccine. We haven't seen yet what the Moderna vaccine, which potentially is coming this weekend as another one with EUA. We don't know the categories on that. We don't really anticipate that it will be authorized for that group either, because not a lot of study has been done on that age group.
While you're there, I got a quick question. I saw a report that said the Pfizer vaccine vials have more ink. Does that mean more people are getting vaccinated in Oklahoma than you originally expected, or how does that work?
So yes, that is correct. What we're finding, we found this out on day 1 and 2 of administration. We started getting reports back that they were able to get 6 doses, sometimes 7 doses out of the 5-dose vial. And we reached back to CDC to make sure we had authorizations to continue to use those doses, because the EUA authorization was for 5 doses per vial. They've given authorization, so now we're looking at potentially, a 20% increase in the vaccine we've got in those doses. So if you're talking about 40,000 doses into the state, that's about potential for 48,000 that we could get. Now, it depends from vial to vial, so we'll have to see how that plays out. But yeah, that's great news for us that we can get additional resources out of what we've been sent.
But I imagine you still have that shelf life issue, so you've got to get those out fastest.
Sure, when you have a vial open, you're going to go through that vial and use it and then move on to the next one. So that extra dose will be used as we move through all the vaccine. So I don't anticipate shelf life will become an issue for that.
Do you anticipate children will be quarantined at school? Because I assume COVID's not going to go away in school, children can't be vaccinated.
So we'll continue to work with the schools to make sure that they have the safest environment possible. We'll continue to work with them on the best possible mitigation measures to prevent transmission within the schools. Some of that, I'm sure, will involve some level of quarantine, and we'll also work with the new guidance that allows for a 7-day test out on quarantine, which gives the schools a little better options than the 14-day quarantine.
Deputy Commissioner, can you explain to us when it's safe, like after you get the first shot, not automatically safe, and then how long are you after you get the second shot?
So we know that there is some level of protection you'll get with the first dose, but with these vaccines that have been approved for 2-dose regimens, we want everybody to remain cautious until after they get that second dose, and typically we're looking at like a 10-day wait after the doses to get the full effect.
Thanks, everybody.